Hey, thanks for joining Dr. Wood and I for a chat. We're talking about screening tests before you have a baby, things that we want to prepare for. Obviously, well, some of us can prepare, some of us can't. But
sometimes the pregnancy happens before you can prepare.
That's right. What are those screen tests that we should probably...
So firstly, you should probably go to your GP if you're planning to fall pregnant and just have a routine screening test to see if you need any vaccinations, like vaccinations for rubella or chicken pox, such things like that.
Because these things can pass on to your baby?
Well, no, if you get an infection like rubella during your pregnancy, they can have a really bad effect on your baby. So if you have vaccination before you fall pregnant, then your baby's protected.
So that's some standard checks?
Standard stuff.
Right.
But there's new stuff now called genetic screening or genetic carrier testing. So you may have a condition, or you may be a carrier for a condition, and your partner may be a carrier for a condition, which you wouldn't know about. There would be no family history. But if those two genes were to combine, then there's a high risk that your baby may then have that condition. For example, cystic fibrosis is a common one. 1 in 25 people carry the gene for cystic fibrosis and probably have no family history that they're aware of having cystic fibrosis in their past family history.
Right.
If you have that gene and your partner has that gene, then the combination together could lead to a baby having cystic fibrosis. So the way the genetics work is that if the two genes, if you're the carrier, the baby has a 25% chance of not being a carrier and just being completely normal, has a 50% chance of just being a carrier and still being normal, and then there's a 25% chance the baby may actually have the condition.
So I guess these tests are for parents requesting these tests to get done?
Correct, yes. Okay. It's a new initiative.
We pay for these tests?
At this stage, yes. But there's moves to it being covered.
Right. And so what's the process of having
the process? Normally, you need to go to a specialist or a genetic counsellor.
That your GP can refer you to? GP
can refer you to, or you speak to your obstetrician that you're planning to go and they can refer you as well. It may just be a swab from your mouth, or there may need to be a blood test. It depends on the different tests that they're doing. And it's a simple test. You get the results back in a couple of weeks, and we will then have the results to be able to discuss it with you over the phone.
Right, and I guess parents can make the decision there as to, you know...
Yeah, well, let's say, for instance, you were a carrier of condition, of a particular condition, then you could undergo IVF.
Okay.
And they can then select the embryos, they can do tests on the embryos and select the ones that don't have that condition so that you're not passing it on.
And I think that's a whole different topic altogether.
It's a very big, long topic, that one there.
Thanks so much, Dr. Wood, for those tips. I hope that's helped you. Keep it locked right here at Mums at the Table.